The Kerala government on Thursday decided to impose more stringent curbs from May 4th to 9th, with the state's daily surge of COVID-19 cases crossing 38,000 and virus caseload touching the 15 lakh mark on the day. With fresh cases increasing exponentially, there is a need to strengthen further restrictions in addition to the present weekend lockdown-like curbs on Saturdays and Sundays. Chief Minister Pinarayi Vijayan told reporters. For a week from May 4th, stringent restrictions will be in place. People should follow self-lockdown, the CM said. Indoor and outdoor shooting of television serials and documentaries will not be allowed. Vegetable and fish market vendors should maintain 2-meter distance, wear double masks and gloves, he said. Police personnel have assured that there will be no problems with regard to oxygen transportation. Vehicles transporting the life-saving gas cylinders, medicines and medical equipment should be marked clearly to help police identify them and ensure safe passage through the traffic. Dedicated oxygen war rooms at the state and district level will be set up, the Chief Minister said, adding that the collectors will monitor the availability of oxygen in their respective districts. Lockdown should be the last resort, but we are not able to control the spread of the virus. Though people are cooperating in many places, there are reports of COVID guidelines being flouted from some areas, he said. Meanwhile, the Kerala Government Medical Officers Association on Thursday urged the state government to impose 2-week lockdown in view of the rise in cases. Only shops selling essential commodities would be allowed to function, and they should encourage door delivery of goods to avoid contact with people, Pinarayi Vijayan said. The Chief Minister also pointed out that though banking hours were from 10 am to 2 pm due to the present situation, some branches were forcing the staff to work beyond these timings and asking them to do canvassing works. The state will give priority to those who are eligible for the second dose of the vaccine. There is no need to rush to COVID vaccination centers for this. The second dose of Covishield vaccine should be taken within 6 to 8 weeks and Covaxin within 4 to 6 weeks. A list of those eligible to receive the second dose of the vaccine at each vaccination center will be available on the CoWIN portal. The slot for the first dose will be allowed for online booking only after giving preference to those taking the second dose, he said. It is now estimated that vaccinating the vast majority of people over the age of 60 in the first phase of the COVID outbreak has helped reduce mortality in the state. We have been able to successfully implement early vaccination, and this is the reason why the mortality rate is not rising proportionately despite the current rapid spread of the disease, he said. A committee has been set up under the Home Secretary to monitor the availability of oxygen. The oxygen module will be prepared and added to the COVID Jagrada portal. This will help in better utilization as oxygen stock figures will be available in each district, he added. News Desk, Kaumudy, English.